Good day, everyone. I am Masato Kyle Muhilio, and I am the next reporter in our group. Knee and low back pain. There are several factors that predispose gymnasts to low back injuries. These factors include the high intensity and high repetitions completed at practice, performance of rational and hyperextension skills, strength imbalances, and incorrect technique. One common back injury sustained by gymnasts include spondylolysis, spondylolisthesis, muscle strain, and injury to the intervertebral discs. The most common cause of low back pain from gymnastics is lumbopelvic dysfunction. This is when there is a deficiency in the movement of the spine and pelvis in space. Gymnasts are also prone to stress fractures in the spine called spondylolysis or pars fractures, a result of repetitive overuse with improper stabilization. Spinal fractures and herniated disc. Vertebrae fractures. These typically result from acute injuries during the course of a gymnastics routine. Herniated disc. Falling from a great height or simply landing funny can result in a slip spinal disc and potential nerve impingement. This kind of injuries is caused by routines in gymnastics, just like falling from a great height and then land. Achilles tendon strains or tears. Gymnasts can suffer from a variety of injuries to the Achilles tendon located just above the back of the heel, as a result of the repetitive stress of jumping and landing. Achilles tendinitis results in calf soreness that is aggravated with jumping and landing. When you experience this pain, possibly severe, and swelling near the heel, an inability to bend the foot downward or push off the injured leg when walking, an inability to stand on the toes on the injured leg, a popping or snapping sound when the injury occurs. Ankle sprain. In most cases, sprains are minor. However, many gymnasts suffer from more serious sprains as a result of the speed of movement and heavy impact on landing. Minor sprains damage the ligament slightly, while serious sprains can lead to the ligament being partially or completely torn. A sprained ankle is an injury that occurs when you roll, twist, or turn your ankle in an awkward way. This can stretch or tear the tough bands of tissue or ligaments that help hold your ankle bones together. Shoulder instability. Partial dislocation means the head of the upper arm bone is partially out of the socket, causing pain and instability in the shoulder. Complete dislocation means the head of the upper arm bone is completely out of the socket. Both partial and complete dislocations causing shoulder pain and instability. So this will occur because gymnasts put a lot of pressure in their shoulders to perform stunts, and this will be the reason why this injury occurs. Cole's fracture. Cole's fracture prevails in all cases. When falling, a person leans on a palm reflexively. If a fracture occurs, the bone fragments are shifted to the back side. A Cole's fracture is a type of broken wrist or fracture. It's also called a distal or away from the center of the body fracture with dorsal angulation or an upward angle. Smith's fracture occurs less commonly, the exact opposite of Cole's injury, which is found in the case of falling on a hand that is concave inward. Therefore, the fragment is shifted to the palm. A Smith's fracture is a break to the end of the radius. The end part of the bone, which forms part of the wrist joint, is displaced or angled in the direction of the palm of the hand. Often, this injury occurs by a fall to the back of a flexed wrist but can occur in any fall to an outstretched hand. Stingers or burners. A stinger or burner is an intensely painful nerve injury. The nerves that give feeling to the arms and hands originate from the cervical spinal cord. As these nerves leave the neck, they form the brachial plexus. They weave together then branch as they pass under the clavicle or the collarbone on the way to the shoulder. Stingers or burners are injuries to the nerve network that provide feeling and muscle control in the shoulder, arm, forearm, hand, and fingers. So here are the 10 most common gym injuries. So the first one is shin splints, followed by knee pain, wrist strain, IT band issues, rotator cuff injury, low back strain, sprained ankle, elbow pain, pectoral strain, and groin pull. Shin splints, pain that seems to radiate along the inner edge of your shin bone or the tibia, may be a sign of medial tibial stress syndrome, more popular known as shin splints. Common in runners, and shin splints occurs when overstressed muscles in the front lower leg cause pain along the shin bone. Shin splints is an inflammation of the muscles, tendons, and bone tissue around your tibia. Pain typically occurs along the inner border of the tibia where muscles attach to the bone. Shin splint pain most often occurs on the inside edge of your tibia or the shin bone. Knee pain. A vague discomfort around the kneecap can signal knee patellofemoral syndrome, also known as runner's knee. Often related to poor tracking of the patella, you may hear a creaking, crunching, or grating sound as your knee moves through a normal range of motion. The knee is a vulnerable joint that bears a great deal of stress from everyday activities, especially when going to the gym. So here are the causes of knee pain. Wrist strain. The wrist is a complex joint with a high degree of mobility, but high mobility and instability often go hand in hand. One to many Wrist strain. The wrist is a complex joint with a high degree of mobility, but high mobility and instability often go hand in hand. One to many barbell curls with a straight bar or a workout with a ton of push-ups can overload the wrist and strain the surrounding muscles. Front squats and other exercises that require significant shoulder mobility to keep the weight of the wrist can also place unwanted stress on the area. Too much strain and pressure will naturally cause your body to collapse, and in extreme cases, all of your body weight could drop onto your hand and wrist, leading to a strain. So that's all for my part, and let us proceed to the next reporter. Thank you.